Hello, my name is Patrice Cannon, and I'm here to talk about cognitive processing therapy, also known as CPT. And basically, CPT was originally developed by Patricia Resick in the 1980s to treat PTSD. So it was frequently used with military veterans, survivals of sexual assault, so individuals affected by violence, and along the lines of traumatic situations. And so um, it focuses on the relationship between our thoughts and our emotions and our behaviors. A lot of times with post traumatic stress disorder, with PTSD, often are results from negative beliefs and avoidance behavior that stem from a lot of our trauma. So the individuals with PTS frequently experience a lot of our intrusive thoughts, avoiding to kind of, they don't want to relive the trauma again, which is understandable. So they just avoid it altogether. They avoid places, people, discussions. They may even have a negative self perception of themselves. Maybe it was my fault. I'm a weak person. A lot of times, heightened anxiety or lack of sleep are also common factors of PTSD. And so, as we kind of go a little bit further in talking about CPT, some of the central constructs of CPT is assimilation, the tendency to alter the traumatic memories to fit the beliefs, the over accommodation, which is a big one, and also just a lot of the overgeneralizing. Bad things always happen to me, I'll never recover from this. And so a lot of those intrusive thoughts and the cognitive distortions are inaccurate. So, a lot of the negative thought patterns that shape how individuals perceive themselves and the world. Along the lines, also Resick she studies something called stuck points, which are negative thoughts preventing recovery. So some of the stuck points are rigid and maladaptive beliefs that prevent the individual from moving forward after the trauma has happened. So these thoughts reinforce distress and often lead to avoidance, guilt, or fear. They typically develop as a way to make sense of the trauma, but instead they keep individuals trapped in negative thought cycles. So some of the common stuck points are: I should have done more to stop it, I can't trust ever again, because of what happened, I'm worthless. So a lot of people may not feel like they are worthy of love because something traumatic has happened to them. So there's a lot of self blame and guilt that goes along with trauma. Like for example, you may have a survivor in a car accident, and they may believe if they had left home earlier, this would not have happened. So this belief creates self blame and guilt, reinforcing the emotional pain, which prevents recovery. So through CPT, the individual would examine the evidence, and was the car accident truly your fault? And so we would just kind of examine that thinking and try to replace it with more healthy thinking. So, what are some causes of the dysfunction in the CPT's view? Some of the causes is a dysfunction results of the maladaptive thinking, as I just said before. Some of those thought patterns about the trauma, the self blame, the guilt. Um, Also, avoidance is a big one because avoiding is a key factor that keeps PTSD symptoms active, and it prevents recovery. So some people just avoid it altogether. So it might be a smell, it may be an experience, it may be loud noises, whatever it is. Some people just avoid it altogether, which prevents recovery. So in CPT, it helps the trauma survivor identify and challenge and replace negative thought patterns with a more healthier and a more balanced perspective. So we really make sure we want to get down to those maladaptive thoughts, the self-blame and the guilt. The nature of therapy in CPT. And so Resick did quite a bit of research in this area, and it's about 12 sessions, but of course it could go way longer depending how the patient is progressing through the therapy. And the goal of this is to build a trusted and therapeutic relationship to make the client feel safe and supported, and we want the client to feel comfortable while going through therapy. So this is more of a structured and um, environment, and it's a step-by-step process. And so some of the steps is that we first want to an introduction in establishing trust with the client, and then we want to we want to educate the client about trauma and the impact of trauma. So we want to help the client understand how trauma affects thoughts and emotions and our behaviors. We also want to help the client become aware of their automatic thoughts, especially those linked to trauma. So the therapist is going to teach the client to track their thoughts and feelings in response to situations that may trigger the client's trauma. Another step in this is cognitive restructuring. So we want to make sure that our challenge that we challenge irrational and unhelpful thoughts related to the trauma and replace them with a more balanced and realistic thought. So in CPT, it really is a lot of facing those intrusive thoughts, those negative thoughts head on, and trying not to get the client away from avoiding those thoughts and facing them head on so that they can recover from their trauma. Another step is we want to process the trauma narrative. So we want to help the client integrate the traumatic event into their life narrative in a healthier way. We want to develop new beliefs and skills and support the client in developing a healthier and more realistic belief about themselves, about the world, about other people. We also want to make sure we prepare the client to manage any future challenges to prevent a relapse. Also, finally, We want to close the therapy relationship, and prepare the client for continued healing. So there's like ongoing things after the client is in therapy. So the role of assessment is probably the most important part of CPT because what it does is a critical component in tailoring therapy to the unique needs of the client, because we know that everyone experiences, you may have two sexual assault victims, but they could be experiencing their situation very differently. It serves as a foundation for creating a personalized treatment plan that addresses the challenges and the goals of the individual. So we want to make sure that we have the right assessment and one that is going to help us identify key areas that need the attention, such as the trauma symptoms and the maladaptive beliefs and the emotional regulation difficulties or coping skills deficits. So it's going to allow the assessment is going to allow the therapist to set clear goals for the client, to be able to monitor the progress. There may be a time where you have to go back to step one because something has probably set off the client, or maybe the client was triggered, and so this is definitely a progress. An assessment will help you monitor the progress of the client. The assessment is also going to ensure that we have appropriate interventions, because one size definitely does not fit all when you're in therapy. So, the role of the client and the counselor. So, basically, the therapist is probably more of a structured role. Of course, you want to build trust with your client, but you also want to provide a clear framework for treatment. And you want to organize the sessions in a way that gradually builds the client's skills and understanding. So, a structured approach ensures that the relevant areas of the client's trauma and the cognitive patterns are addressed without becoming overwhelming. We don't want to give the client too much. We don't want to start peeling back the onion all the same day. We want it to be a gradual process to gradually get the client to respond to therapy. Um, the client participation is extremely important, because that's what determines the success of therapy. So, especially like when you're talking about CPT, there may be some homework assignments, or the therapist may ask the client to kind of write down when they're having those feelings or those emotions and those thoughts. And so, there may be a homework component in this that the client is definitely going to have to make sure they do and participate in their therapy. So some of the goals of CPT definitely, it works. It's going to, we want to make sure that we're guiding the client to reframe these negative beliefs and adopt more adaptive thinking. So we want the thoughts to be more balanced, more flexible, and more reality based. We want to identify and challenge the cognitive distortions with CPT therapy. And we also want to promote realistic and balanced thinking. You know, we want to evaluate evidence. Like, what evidence do you have to say that this thing that you feel this way? So if you're feeling guilt and you're feeling shame, what evidence do you have that this is your fault? So we definitely want to make sure that we're changing that thinking. So some of the key techniques of CPT is the cognitive restructuring, and reinterpreting the trauma narrative, Socratic questioning, definitely practice assignments. So some of the cognitive restructuring, it helps the client identify and challenge the cognitive distortions, you know, as I've said throughout this presentation. So a lot of times clients feel stuck in their emotional reactions and preventing them from processing through their trauma to get to a healthier place. Um, we want to, the reinterpreting the trauma narrative is a powerful technique because it allows the client to view their trauma from a different perspective. And so often reducing self blame and shame. Some of the Socratic questioning, what I mean by that is it's a tool used to gently guide clients to critically examine their beliefs, particularly those that keep them stuck in an unhealthy pattern. So, by asking open ended questions that challenge the client's current thoughts, the therapist can encourage them to test their beliefs against evidence. So, which helps them shift their thinking in a way that promotes emotional processing. And so I'm going to talk about a case example because CPT is used for a lot of our veterans that are struggling with PTSD. And if I'm thinking about a client, you know, a military veteran struggling with PTSD, and some of the presenting issues may be nightmares, avoidance, different things like that. Identify a guilt based. He's stuck in feeling guilty, so we want to reframe the self blame using cognitive techniques, and we want the outcome to be that reduction in distress improves daily. So some of the things that we may do with this client is identify the guilt based stuck point. So let's first identify like your thinking and these negative thoughts, and let's address them. So the client may have a thought of, I could have saved my comrades if I acted differently, or I failed to protect the others, or I'm unworthy of peace and safety because I wasn't able to prevent something from happening. So, the next step after we have identified these stuck points, we want to reframe the self blame using cognitive techniques. And it's just the therapist maybe asking a question like, what evidence do you have that suggests you could have acted differently in the moment? Where there are factors beyond your control that influence the situation. And we will see how the veteran respond, and we will continue to keep asking these open-ended questions to get the client to think differently. Another step that we would have with this particular client, the military veteran, is we would modify and reframe the guilt-based beliefs. So maybe the old belief would be, I failed to protect my comrades, and that makes me a failure. And maybe the reframe belief would be, you know, I did my best. I could, I could have, you know, given the circumstances, I did the best that I could. And while the situation was definitely tragic, I'm not solely responsible for what happened. The circumstances were beyond my control. So definitely getting him to think differently past those stuck points. So let's critique CPT for a little bit, because although there has been, CPT is well researched and it's a well researched therapeutic approach for trauma, particularly for PTSD. And there has been extensive studies and extensive research done around this. Actually, some of the empirical support that the research has shown that up to 60 to 70% of people with PTSD experience substantial reductions in their symptoms after they complete CPT. Some of the hiccups in this is because there's a lot of writing assignments and homework. So if you have a client who doesn't write well or writing is not their thing, that could also be, that could kind of interfere with their therapy. Or you may have a client who don't express their emotions very well, and it takes a long time to try to get them to open up, because you really want to acknowledge the intrusive thoughts and the negative thinking. You want to get on top of that. If you have a client who really just doesn't open up about emotions, that definitely can prolong some of their therapy. So that is the cognitive processing therapy in a nutshell. Here are some key resources that I used for this presentation. Thank you so much.